So my topic was Crohn's disease. I decided to do kind of a generalized teaching on the topic. First of all, what is Crohn's disease? It's inflammation and ulceration of the gastrointestinal tract, often where the small intestine meets the large intestine, and the medical term for that is distal ileum. It can involve the entire GI tract, which is from the mouth to the anus. This also includes malabsorption and malnutrition, and supplements usually are required as part of the treatment for this disease. So patients will usually ask, how do you know that I have Crohn's disease, or something along those lines. And some of the signs and symptoms that you can point out to them that they have already told you that they have is abdominal cramping, anorexia, weight loss, fever, diarrhea, which can be characterized as 5 stools per day with mucus or pus, abdominal distension, tenderness or firmness during palpation, and also high-pitched bowel sounds, which they might not know what that is, but you can describe it to them a little bit better. You should also, if a patient tells you, well, I don't have all of those things, you don't necessarily need to have all of them, but some or one, or depending on the person and what their lifestyle or at the point of their disease process might be. What lab tests should I expect? So hematocrit and hemoglobin, erythrocyte sedimentation rate, which is usually ESR, white blood cell count, C-reactive protein, serum albumin, folic acid and B12, anti-glycan antibodies, stool test for occult blood. Patient might not know what that means, but basically, I think we all know what it is. You test the patient's stool to see if there's blood. It doesn't necessarily need to be red or black, but that's why the word occult is in there. Urinalysis, you do this. You might think that, or the patient might think that you don't need a urinalysis because it has something to do with their GI tract and not their bladder or kidneys, but usually this is done to see if there's any white blood cells in the urine. Potassium, magnesium, and calcium are also done, and depending on the elevation or depletion of certain tests, doctors or nurses will know whether or not the person in fact does have Crohn's disease, and this is more so that you can show them yeah, these are your tests, these are your results, this is what you have. Probably in a nicer way than that. Diagnostic procedures, endoscopy. There's no technology where you can swallow kind of like a pill capsule, and it takes a video of your GI tract from your mouth all the way to the exit. A proctor sigmoidoscopy is an exam of the rectum and lower part of the colon. It's named after, obviously, the sigmoid scope, which is a thin lighted instrument. It's inserted into the rectum, and then you can visualize what's going on up there. Abdominal ultrasound, x-ray, CT scan, and a barium enema is inserted into the rectum as a contrast for x-rays, and that will allow the visualization of the rectum and large intestine, and the doctor can see if there's certain things going on in the GI tract. You always want to include education for what types of medications the person's going to be needing to take for their new disease or the continuing treatment of their disease. So aminosalicylic acid, sorry, I probably butchered that. It reduces the inflammation of the intestinal mucosa. Corticosteroids reduce inflammation and pain as well. Immunomodulators suppress immune response and prevent tumor necrosis factor. Anything that affects a person's immunoresponse, you want to make sure that you tell them to be extremely careful. Wash your hands. Don't go around large crowds or people who might be sick, because your immune system obviously is not going to be as strong as a normal person. And antidiarrheals suppress the number of stools, which this can help a little bit with malnutrition. Because if you have diarrhea, obviously you are getting rid of all of your nutrients. which is never a good thing. You always want to make sure that you educate your patient to take their medication as it's directed, as with any other medication. And you want to tell them to notify the healthcare provider if they are experiencing any side effects that they weren't having prior to the medication, obviously. Also, make sure they do not stop the medication without speaking to their provider, because they might want to stop the medication because they're having some type of side effects, or they're uncomfortable, they feel like it's not working, etc., etc. And then that way the healthcare provider can reassess the situation and see if maybe they need a lower dose, or they need a different combination of medications, or there can be an endless list of things that the healthcare provider can do for that person to make sure that they're getting the best treatment for that individual.